In America, there are people who lack health insurance. The reason why most people without health insurance do not have it is because they cannot afford it. When something goes medically awry, these people are taken by ambulances to the emergency room, both of which are very expensive, especially for someone without insurance to help cover the costs. From 2010, when the Affordable Care Act was passed, there had been a decline in the number of uninsured Americans. Since 2016, however, the number of uninsured Americans has increased. Between 2016 and 2018, around 4 million people lost individual coverage. The people with employer-sponsored coverage remain consistent. Adults from 19 years old to 64 years old went from 12.7% uninsured to 15.5% uninsured. Adults with incomes around $30,000 for an individual and $61,000 for a family of 4 increased from 20.9% uninsured to 25.7% uninsured. So how much does an ambulance ride cost for an uninsured individual? While costs vary place to place, a typical out-of-pocket price for an ambulance ride ranges from $400 to $1,200, as long as the individual is not in a city where these services are covered by taxes. Depending on the ambulatory services, additional costs could include a per-mile fee, as well as charge the individual for oxygen masks, dressings, burn kits, and so forth. After being taken to the hospital by an expensive ambulance ride, the individual is then sent to the emergency room. For an uninsured individual, emergency room costs can typically range from $150 to $3,000. Sometimes if critical care is needed and/or surgery is performed, the cost can be as much as $20,000 and above. In 2016, a 46-year-old software engineer, Roman Barshay, was visiting his friends in the Boston suburb of Chestnut Hill. After a fall, Barshay had trouble walking and felt sharp pains in his back and chest. An ambulance came to pick him up after a 911 call and took him 4 miles to Brigham and Women's Hospital. The doctors determined he had some sprained ligaments and tendons as well as a bruised foot. About 4 hours later, he was released. Once Barshay went back to Brooklyn, his hometown, he received a bill for $3,660. Thankfully, Barshay was insured, but his insurance only paid half the bill. If he wasn't insured, he would have been expected to pay the $3,660 in full. Ambulance and emergency room fees are outrageous to start off with. Even more outrageous, though, is the American healthcare system, where the people who are least likely to afford it get the most expensive healthcare. Because these uninsured people cannot afford adequate checkups and appropriate menial health care, their health problems are more likely to build up into a larger, unignorable issue. When suddenly this larger issue needs to be treated, an uninsured individual is left with no choice but to take an ambulance ride to the emergency room and would later receive a bill that they cannot afford to pay off. Cutting prices of ambulance rides and emergency rooms is a lot more complicated than it may seem. America is a capitalist society, which means reducing medical costs or even providing health care for everyone is tough and always comes back to the same question: who will pay for it? Although the perfect solution may not even exist, something needs to change because the current healthcare system bars the lower income portion of society from receiving adequate health care. Everyone has the right to life, including those who struggle to afford it.